Now, India is on high alert after positive cases of coronavirus mounted to 25, taking the total cases of the virus since the outbreak to 28. 17 people in the national capital, including 15 Italian tourists, have been tested positive for the coronavirus infection. 6 have been tested positive in Agra, 1 in Hyderabad and 1 in Jaipur. All those who have tested positive have been quarantined. 3 people who were tested positive for the infection in Kerala have now recovered. In a tweet, Prime Minister Narendra Modi said he would not participate in any Holy Millen program and also urged the people to avoid public gatherings. A group of ministers will be holding a meeting very shortly on the crisis. Health Minister Harshvardhan in a briefing said 15 testing centers have been established and 19 more are to be established. He said over 5 lakh people have been screened so far. 2 suspected cases of the virus emerged in Maharashtra as well. One of them is in Mumbai, the other in Pune. The results of both these patients are expected by the end of the day. Now, with multiple advisories and suggestions making their rounds to help you protect yourself from coronavirus infection, let's just simplify. Let me simplify it and tell you the basic measures that you can take at home for yourself and for those around you. Number 1, carry and use N95 mask to cover your mouth and maintain distance from those seen coughing and problem. Right now, a lot of masks are out of stock, but the government assures that they will be back in supply very soon. Now, in case you cannot find an N95 mask in the market, you can make one at home using 3 layers of cotton cloth, which in this scenario will also be effective. Wash your hands with the soap frequently as possible. Make sure that you rub the hands with the soap for at least 20 seconds. Carry and keep using an alcohol-based hand sanitizer frequently. Avoid touching surfaces, especially in public areas, as the virus spreads through droplets which settle on the surfaces when somebody sneezes or coughs. Get yourself tested at a government lab in case you have traveled overseas. Call up the helpline number which has been set up by the government, both if you're in Delhi and there is a central number as well. The information and the procedure and details of the government labs will be provided in these helpline numbers. Those with weaker immunity, including patients with diabetes, heart diseases, cancer patients, are more prone to the infection and must stay home for 2 to 3 weeks. Avoid gathering and celebration, especially on the upcoming festival like Holi. Avoid swimming, especially in the public pools. Now, we also spoke to India's top doctors on coronavirus outbreak. This is what they have to suggest on how to keep yourself safe. Listen in to Dr. Naresh Trehan, Chairman and MD, Medanta.
I would think that it's unnecessary. Hopefully, everybody will see many more Holis as they come. But if you're going to have strangers who we don't know where they have been, what their status, whether they have a cold or a cough or any symptoms of it, or have they had exposure to somebody else who's had coronavirus, I think it's safer if you avoid those kind of interactions. As far as the availability of masks is concerned, you need a 3-layer surgical mask, which can also be made out of cloth. If you are finding it difficult, because there is a short supply, there has been too much demand, some of it has been exported also to other countries, that you can make a 3-layer mask out of cotton cloth. That would protect you also.
All right, let's now listen in to what WHO scientists have told India today on the coronavirus outbreak in India.
We have seen positive cases in India, and now people are in a panic mode. Do you believe citizens of our country need to panic?
No, of course not. The country, India, has been preparing for this since this was a public health emergency announced in end of January. And even before that, the alerts came to all countries in terms of how to manage and prepare for containing the coronavirus cases in the country.
Do you think India as a country has enough trained doctors, nurses to deal with the increasing number of cases that we are seeing? Also, what do you think are the foremost things that the citizens should do to make sure that the number of cases don't multiply?
I'd start with your second question. There is a lot an individual can do to help prevent the spread of coronavirus. First of all, is washing hands. This is the most basic weapon every person needs to be able to practice to stop the spread of coronavirus. Number two is cough etiquette. If you are going to cough or sneeze, cough on your elbow so that you don't spread droplets that may carry the coronavirus. And if you are really symptomatic, please don't go to work. You can wear a mask if you have to move, and do some isolation at home. That will prevent the spread of the coronavirus, like any other virus, like during influenza season, the flu season, where we have even more spread of cases and actually deaths. So your other question, this is a system that needs the whole preparation. So the country, India, the Ministry of Health has been very vigilant and diligent in doing surveillance, event-based surveillance, contact tracing, testing for all cases. If you remember, there were repatriations of Indian citizens from Wuhan, and those were all isolated, quarantined, and they were tested. It is a system that's geared up for this. The scale up, of course, is something that you have to keep. What do you say? You have to keep at it. It doesn't stop with one case, two cases here and there. It has to be a whole system that works. Two, risk communication. You in media are our partners. You have to be able to communicate well to people that these are simple things that we can do. Three, our hospitals need to practice infection prevention and control. There are many hospitals that are able to do this. It's just gearing up for more cases, but the capacities are there.
I think we should avoid using the words killer virus because it creates unnecessary panic among people. This is a virus which belongs to a family that causes the common cold. And so it's 80% of people who get this viral infection don't even know that they have it, or they have very mild symptoms. They just have a cold and a cough and a body ache, and it goes away in a few days. It's only a small proportion, 15 to 20% of people who develop pneumonia and more serious symptoms. So first of all, I think for people to know that this is not a killer in the sense it's not fatal if you get this viral infection. The older people and those who have some underlying health problems, they are the ones at higher risk for complications. So there we need to be much more careful. So as I said, we're learning more and more about this virus, about how it spreads and the clinical management of this. And we're also working on the new tools, the diagnostics, the new drugs, as well as vaccines. But all of those, diagnostics we already have, but for vaccines and therapeutics, it's going to take a little bit of time to do the research. Meanwhile, it's really just a message I wanted to give is, meanwhile, what is important is simple, well-known and well-tested public health measures that need to be used, and that's what India has been doing.
As several nations battle the corona crisis, the World Health Organization has released an explainer on how the virus is spread and what are the precautions that can be taken. Take a look.
COVID-19 is an infectious disease caused by a new coronavirus introduced to humans for the first time. It is spread from person to person, mainly through the droplets produced when an infected person speaks, coughs, or sneezes. These droplets can land in the mouths or noses of people who are nearby. These droplets are too heavy to travel far in the air. They only travel approximately 1 meter and quickly settle on surfaces. This is the reason person-to-person spread is happening mainly between close contacts. The exact time that the virus can survive on surfaces is not yet known. So it is wise to clean surfaces regularly, particularly in the vicinity of people infected with COVID-19. Hands touch many surfaces, which can be contaminated with the virus. You should therefore avoid touching your eyes, nose, or mouth, since contaminated hands can transfer the virus from the surface to yourself. When coughing or sneezing, cover your mouth and nose with the bend of your elbow or use a disposable tissue. If a tissue is used, discard it immediately into a closed bin. The most effective way to prevent the spread of the new coronavirus is to clean your hands frequently with an alcohol-based hand rub or soap and water. This will eliminate the virus if it is on your hands.
Amid the rising number of positive cases of coronavirus in India, a major worry for Delhiites, in fact, is that there is a acute shortage of hand sanitizers and masks. This after several medical stores have run out of sanitizers and masks owing to excess demand. Similar scenes can be witnessed in Gurugram. Pharmacists have reported shortage of sanitizers. 17 people in the national capital, remember, so far, including 15 Italian tourists, have tested positive for the coronavirus.
सैनिटाइजर चाहिए था, मास्क भी चाहिए था, नहीं अभी तक तो नहीं मिला। कहाँ ढूंढे? यहाँ के सारे मेडिकल स्टोर पे ढूंढ लिया हमने।
मास्क की तो ये पोजीशन है, कस्टमर कहीं वापस जा रहे हैं और एक से किसी से कमा रहे हैं, आ रहा है तो उसे ज़बरदस्ती खींच के लिए हमने 4 गुना रेट में। कल से ही शुरू हुआ है, एक तरह से अखबार में जब आया ना अखबार में, तो एक तरह से सब शॉर्टेज हो गई।
इस समय हमारे पास डिमांड है थर्मोमीटर की, सैनिटाइज़र की और मास्क की। तीनों में से कुछ भी हमें बाज़ार में मिल नहीं पा रहा। हम लोग इतना परेशान हो गए हैं कि क्या करें, समझ नहीं आ रहे। सुबह से ग्राहक आ रहे हैं, सबको वापस भेजना पड़ रहा है हमें मजबूरन।
इस समय पर हैंड सैनिटाइज़र और मास्क की शॉर्टेज बहुत ज़्यादा है। डिमांड है पर शॉर्टेज बहुत ज़्यादा है। जहाँ अवेलेबल है वहाँ रेट्स उल्टे सीधे, मतलब जिसका जैसा मन चल रहा है। 2 रुपये की चीज़ को 10 बोलता है, 10 की चीज़ को 50 बोल देता है।
Now, gold has hit a 7-year high as coronavirus cases continue to surge outside China, triggering fresh fears of the pandemic, and stock markets around the world reeled under the impact. Gold touched 43,500 following an interest rate cut by the US Federal Reserve to calm down coronavirus fears. Due to the increase in the prices, demand for the yellow metal has gone down. Shopkeepers are facing huge losses as it is the wedding season and people are moving to alternate options like diamond and platinum instead of buying gold.
Right now we've seen because of the coronavirus, people's businesses have come down drastically, where imports from China have stopped down, even exports in a lot of countries have been banned. So people are currently probably, they are sustaining and they are not making a lot of money. So people are not buying gold at the moment or investing more into gold. But because of that, we've seen that gold has gone up pretty high because of the economic issues. And we can even see the rupee, which has fallen down drastically, which has come from around, which has reached to 73.67 today. So all these factors are helping in the rise of gold.
और ऐसा मानते हैं कि सदियों से मानते हैं कि जहां महामारी और युद्ध आता है तो लोग सोने की ओर दौड़ते हैं। तो ये देखते हुए जो सोने में जो कुछ महीने पहले की बात करें, जहां सोना इंटरनेशनल मार्केट में $1250 था, वो आज बढ़ के $1650 हो गया। इसी तरह रुपए में बात करें तो जो सोना 30,000 के आसपास था, आज सोना 44,500 और 44,800 के आसपास ऑल टाइम हाई हुआ है। यहाँ पे जो कस्टमर अभी आ रहे हैं वो रिसाइकल्ड गोल्ड, यानी उनका पुराना जो सोना पड़ा हुआ है घर में, वो लाके एक्सचेंज करके नया सोना लेके जा रहे हैं।
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.